Hi, this is Xinyang Tong. I choose the liver disease dataset. First is the dataset description part. Cirrhosis is a late stage of scarring of the liver, and this dataset have 424 data, and the first 312 patients participated in the randomized trial and have complete data, and the additional 112 cases do not participate in the trial. However, they also have complete records. However, the 6 out of 112 were lost. So in total, we have additional 106 cases and 312 randomized participants. And this dataset had 20 columns. Here's the explanation for different columns. And next, we have the data cleaning part. There they have some very important steps. The first is dealing with the missing values. We replace NaN not a numbers with zeros, and we have checked there is no duplicates in the data set. And next, come to the featuring part, we select several columns as features, and we divide those 20 columns into quantitative features and categorical features. And our target feature is stage, which is for the classification. And next, we come to the encoding, and we the original stage have four value, 1, 2, 3, and 4. And after the encoding, we only have two values, 0 and 1, which means we have a binary classification models. And 0 means this patient doesn't have cirrhosis, and which this related to the first, second, and third stage. And the value of 1 means that this patient has cirrhosis. This corresponding stage is fourth. And next, we come to the scaling part. We detect skewness in the dataset features and apply log transformations to numerical features to normalize their distribution. After the scaling, we will later increase the accuracy and prediction of the classification models like linear models. Then we're dealing with the outliers. We use the two keys rule to identify outliers and apply visualization to detect them and then update in the dataset. Next, we have the last part of the data cleaning, which is also very important, is the dummy encoding. We use this method to encode categorical features to avoid multiple linearity, and after the processing, these features will only have n-1 categories. Here is the correlationship heat map graph of different features. And we need to focus on several relationships. First, there's a positive relationship between number of days and the albumin. The number is 0.44, which means there's a strong positive relationship between them. And also, we need to focus on the number of days and bilirubin. The value is minus 0.47, which means there's a strong negative relationship between them. And the negative relationship means that if the number of days become higher, the number of bilirubin will become lower. And there's also positive relationship between proso prothrombin and bilirubin. There's which means if the bilirubin becomes higher, the prothrombin will become higher as well. And since our target variable is stage, we need to focus on the relationship between stage and other features. And the prothrombin and bilirubin and age have positive relationship with stage, while the number of days, albumin, and platelets have negative relationship with stage. Here comes the modeling part, which is the most important part in this section. And first, we split the dataset into training and testing. 80% of the dataset becomes the training part, and the rest of them becomes the testing part. And first, we have the decision tree classifier models, and the results shows the confusion matrix. After the calculation, we can find that the cross-validation score is 0.67, the accuracy is 0.64, the precision is 0.68, the recall is 0.73, and the F1 scores is 0.7. And later we will compare these values with the other models' results. Here's the results from the PyCaret. They have a lot of different models, and they also have a lot of different indicators. Based on different indicators, we will have different selection rules and have different best models. For example, if we choose the accuracy as the indicator to select best model, the best model will be the extra trees classifier and random forest classifier. Since the random forest classifier accuracy is 0.7575, which is just slightly lower than the extra trees classifier, while for the AUC indicator, the best model would be the linear discriminant analysis, and so on. We also, in my opinion, I think the most frequently used and the most reliable indicator is accuracy. So I think the best model is extra trees classifier and random forest classifier. Next, here comes to the last part, conclusion. From the code results, we can see that the liver function makers like bilirubin, albumin are strong predictors for cirrhosis. And age is also a significant factor, as older patients tend to have higher risk. This relationship are drawn from also the correlation heat map and also the classification models. And I think, and for the real world applications, we will have early disease prediction, like for example, hospitals can use machine learning models like extra trees classifier or random forest classifier to identify high risk patients and start early intervention. And also we have another example for the clinical decision support. For the doctors in remote areas or some areas is in lack of medical resources, the doctors can use these models to complement traditional diagnostics and assess patient risks. And thanks for watching.